surprised, but I'm still disappointed.
Porno shit.
Watching the episode.
No.
I don't see them trying to be all like
They're not that big of a mistake.
Quentin? I wish I could.
Casual conversation.
You see that? Oh, yeah. Oh. I was just up here.
I see Joe Bro.
Oh, hi.
I see that you was just trying to snipe.
Joe Bro.
Oh, yeah, that's hot.
Two of them.
That's hot.
So we'll play good. As soon as you get out of surgery, you won't play.
Oh, snap. I thought that was
Yeah.
it.
But you know,
No,
they say
I
we
don't
won't
know.
be it.
He don't.
And now they're going to the playoffs.
Alright, so I'm gonna show y'all a report like how I was writing one. Now I have this listed as I have this listed more as like a paramedic style report, but here would be my report. C, under chief complaint, chest pain, nausea, lightheadedness. H, previous history of bypass surgery, times 3 means triple bypass surgery. 2013, onset today, 8:30 a.m. while walking the mailbox. Patient states he is taking all morning meds, including nitroglycerin times 1, which was prescribed PRN. Write this down. PRN means as needed. So you know how you go to the go get some medicine and the doctor will say take it as needed? You know, like cough medicine.
PRN.
I got a lot of
PRN means as needed.
PRN medicine.
And we write all this down.
No. I'm just showing you how I write a report, just to give you an idea of.
What does PRN mean as needed?
It's just a
Oh, I
medical.
thought he said as mean.
Crap, I'm meant to log in.
PRN means as needed.
Nah, me.
So if you get a job part-time at Metro Ambulance Service, you are looking for a PRN job. What they do is they call you when they have shifts available, and you tell them whether you can come or not.
I got it 97.9 at EC.
Okay.
I don't know what that is.
So what does anybody know what BID means?
What would BID?
BID. If a doctor prescribes you something, BID.
Wait, I want to think about this.
I know what FOS means.
Think about it. 5
It's
days, 2 times a day, twice a day.
Oh.
BID means
I
twice a
didn't
day.
think about that. Dang.
I would have never thought of that. Can't research.
No.
Quentin, what does BID mean?
Back in the day.
Quentin, the next step is I'm going to bring you over here against that wall.
I heard it
And
one
I'm going to
time.
act like you're in about the 3rd grade and you're disrupting class. I'm going to bring you over here against this wall because I moved you up here and you still can't help but turn around.
You should have seen what he was doing earlier. I ain't gonna say what he's doing.
Listen to me, and it's like this right here. If grades were where they were supposed to be, I wouldn't worry about this. But I can't let nobody sit here and fail and also be back there cutting up and carrying on either.
I think I'm gonna pass government with a 67.
It's government
Good enough for me. Yes, miss,
Where
if you get Mr. Luke, you get ready to try.
I got that.
Don't be so extra, my guy.
You had so much government in here. You don't think that was good.
I did really good in law-related education last year because I had this at the same time, and everyone was like, "You're smart," and I was like, "I'm just doing it 3 days before you." But
Alright, you know
Mr.
the drill,
Luke
Jared.
is not a government teacher to play
Spread your
with.
cheeks and lift
He
your
is
sack.
not.
Alright, so here we go.
Like you did.
Chest pain, shortness of breath,
You
nausea,
can't-
and lightheadedness.
He ain't like me.
History, previous history of bypass surgery times 3. That means he had a triple bypass. Back in 2013, on set today at 8:30 a.m. while walking the mailbox, patient states he is taking all morning meds, including nitroglycerin. That's just an abbreviation for nitroglycerin. Times 1, which was prescribed PRN. Y'all know the little, when I say nitroglycerin, y'all ever seen the old men that carry the little bitty brown glass pill
Oh,
bottle?
yeah, that's what you was talking about with the Liberty C pills in
You
it?
got a little bitty tiny thing, little bitty tiny pill, and they put it under their tongue. A lot of people keep them all the time, and if their chest starts hurting, they have what they call angina, which just means they're not having a
I
heart
thought
attack.
one was little enemas.
It means
Don't
they're,
old Emma's come in little brown bottles?
I have no idea, I've never had
I've
no.
seen some in a refrigerator one day.
so anyway, but what it means, they angina, it doesn't mean they're having a heart attack. It means they have heart irritation. They have some problems. And when their heart starts hurting a little bit, they'll drop one of those pills under their tongue. A lot of these old people, they have to stay in that brown bottle because the sunlight or any light makes them lose their strength.
Don't say dissolve.
What is no mark?
They do.
I thought
Do I get a zero
They
for
do.
no mark? Or
Sounds
that
full of
NG?
vitamins, right?
NG is a
What
What you
zero.
saying? Okay, so
Sounds
no
good
mark
for
is
you.
like none.
Means you don't have to make.
Son, yes, I'm saying the nitroglycerin in the little brown bottle is kept in the brown bottle because nitroglycerin weakens the medicine.
Oh.
So, all right, so now let's move on to A, the associated symptoms. Patient is alert and oriented ×3, pupils equal and reactive to light, pulse, motor, and sensory ×4, meaning 2 hands, 2 feet, means all 4 extremities. Pulse, motor, and sensory ×4, normal. No facial droop, means I don't think they're having a stroke. Their speech is clear, their skin is warm and dry, their capillary refill is less than 2 seconds. They have bilateral breath sounds that are clear and equal ×2, both lungs. Their abdomen is soft and non-tender. I don't feel anything abnormal about their stomach. Their oxygen saturation is 94% on room air. Patient complains of a pain scale of 7 on a scale of 1 to 10, is how that's measured. Patient complains of a pain scale of 7 as a crushing or heaviness. States shortness of breath as a smothering sensation. States lightheadedness has improved after sitting down. Pulse 104 and it's consistent with the monitor. Has a sinus rhythm with no ectopy, means no PVCs, and that's just how I write reports. Y'all don't worry about that part. You don't even worry about the monitoring. Y'all would just put pulse 104 and regular or irregular is how y'all would list it. 12 lead, which is an advanced test that I do on the ambulance. 12 lead with extended ST interval present means they're having a heart attack, or either they've had an old heart attack in the past. This right here would be a little bit inconclusive because if I was judging it by an ST interval, he's already had an old heart attack. He's probably got an ST interval every day, an extended interval. But with him having an ST interval and complaining of a new onset of chest pain, I've got to treat this like a heart attack. So, moving on down, that covered, let's see.
How old is this guy again?
I didn't even put an age.
Probably old.
Probably 60, 70 years old for sure. Let's see. Let's see. Blood pressure 160/90. Respiration is 20 and slightly labored.
Get gloves on.
All right, my treatment. I've noted my assessment. Patient assessment is noted above. Oxygen 4 liters per minute nasal cannula. I should have added in there. I'm actually going to add in there. When I want to show that my treatment worked, his original O2 sat was 94%. Now I'm just going to add in there. Alright, so O2 4 liters per minute nasal cannula with O2 sat at 99% while on O2. O2 is oxygen, y'all know that, right? Alright, cardiac monitor, 12 lead, IV of normal saline, KVO, which means keep vein open, means I'm not pouring fluids to him, it's just a route of medication. With an 18 gauge needle in the left hand times 1 stick. I didn't have to stick him twice, just once. Nitroglycerin sublingual. Sublingual's under the tongue. Write that term down. Sublingual.
SL.
SUBLINGUAL. Sublingual. Easy way to remember this. We all speak the English language. If you speak 2 languages, you're bilingual. Sublingual. where does your language come from?
Your
Your
tongue.
tongue, below the tongue. In the
So
little pocket.
sublingual means below the tongue.
Yeah, alright, so the little, y'all ever done the little thing where you take your tongue, do like that?
little
Squirt? That comes out of your sublingual glands. So the little pill goes in the little pocket under either side of your tongue.
Victory. Oh yeah, I do that all the time.
Alright, so, I gave him nitroglycerin sublingual times three different dosages with no relief. I gave him morphine sulfate, 8 milligrams, given in 2 milligram increments until the pain level was decreased to a 2.
So you give him morphine for chest pain?
Morphine's a go-to drug for chest pain. Morphine or fentanyl, I prefer morphine.
It's safer.
No, fentanyl's actually safer, but fentanyl is actually safer, but the morphine actually helps your heart. It doesn't just kill the pain, it actually relaxes your heart. The muscle relaxing.
I was about to say, isn't there a muscle relaxer in that?
So, anyway, I notified Jeff Anderson Regional Medical, everybody stay with me for just a second. I notified Jeff Anderson Regional Medical Center of a STEMI. That's what they call our person that we think's having a heart attack, STEMI. Secured patient to the cot, or the stretcher. Semi-sitting times 3, that means 3 straps. I secured him with 3 straps. Transported him to Jeff Anderson Regional Medical Center, cath lab per my STEMI protocol, what my protocol says I'm supposed to. No further change in patient condition and release to staff.
Look at the soles out of these shoes.
That's going.
Look at this, Brad.
Look at that cheese.
You clean the too?
Yeah, I'm making a video of it. I'm recording it.
How?
I was screen recorder.
How?
I downloaded the screen recorder.
Well, you has one already on it.
Same. Wait, no, I don't.
What you reporting?
Nothing.
Probably some high school DxD.
What?
Mr. Stewart, I've been shooting.
Screen recorder.
They shot the first day the other day, or Friday.
How'd they like it?
I know, I see you
Doing that?
Did they like it?
Yeah.
Who got hurt?
We just got started in it.
I don't want to see that. I don't.
Don't worry.
They ain't even doing like
Exactly.
Take your gloves off, bro.
Let me tell you something. I'm taking one off,
Let me tell you
and the
something.
other one is
Let me
going to
tell
be
you
for
something.
spreading cheeks and lifting sacks. Yeah. Yeah.